Hello, my name is David Donnelly, one of the authors of an article published in the BJUI on urinary bowel and sexual health in older men. As the title suggests, the main objective of this paper is to provide data on the prevalence of urinary bowel and sexual dysfunction in Northern Ireland. While this data will aid service provision within the general population, it has been specifically designed to provide baseline data for studies of prostate cancer outcomes. This will allow comparisons between the prevalence of these conditions experienced in the general population with those experienced by prostate cancer survivors as a result of their treatment. A survey of 10,000 older men was conducted in Northern Ireland by post during September and October 2016, with a 30% response rate achieved. Specific questions relating to urinary bowel and sexual problems were asked using the EPIC 26 questionnaire. Using this data, we report on the frequency of these problems in the population and investigate how these conditions vary by the attributes of older men. We found that 1 in 11 men aged 60 and over reported urinary problems, with this increasing to 15% of men aged 80 and over. Bowel problems were slightly less frequently reported and also varied slightly less by age. However, 1 in 3 men aged 60 and over reported sexual problems to a moderate or big degree, with almost one half of men aged 80 and over reporting difficulties. After adjustments for other respondent characteristics, urinary incontinence was found to be associated with increasing age, number of long-term medical conditions, being unemployed or living in a deprived area, and being obese compared to overweight. Being physically active was associated with a reduced risk. The factors associated with bowel problems are similar, with the exception that age and living in a deprived area are not associated with these problems, while living in a rural area was associated with a reduced risk. The factors associated with sexual dysfunction are the same as for urinary incontinence, but with a much stronger association with age, obesity, and number of long-term conditions, while deprivation was not a significant risk factor. In conclusion, these data provide an insight into sensitive issues seldom reported by elderly men. The results illustrate that urinary bowel and sexual problems are not uncommon among the older male population and could be addressed given adequate service provision. The relationship between these problems, raised BMI and low physical activity, offers the prospect of additional health gain by addressing public health issues such as obesity. In addition, the results will facilitate better understanding of the impact of surgery, radiotherapy and hormone therapy on the quality of life of prostate cancer survivors and will help redress any over-evaluation of the potential side effects of these treatments. Thank you for listening to this presentation.